Give it another minute or two. See a couple people still joining. We'll just give it a few more minutes, folks. Okay, I think we'll get started. Good afternoon, everyone. Thank you for joining our informational webinar on the Shoreline Family Healthcare Intensive Outpatient Program. My name is Michael Wynn. I am the Community Engagement Specialist for BH Care, and I will get us started. Just a few housekeeping notes. Our presentation should take about 30 minutes, and we'll spend another 10 or 15 minutes answering your questions. Please feel free at any time during the meeting to submit your questions through the Q&A function at the bottom of the screen. So with that, I'll get us started. Who are we? There we are. So Shoreline Family Healthcare is a collaboration between BH Care and Fairhaven Community Healthcare, providing integrated primary care and behavioral health care. As you know, BH Care is a behavioral health organization, and Fairhaven, in this case, is providing the primary care. Next slide, please. We are located at a brand new state-of-the-art facility located at 221 West Main Street in Brantford, also known as Lakeview Center. What do we do? As I stated earlier, we provide integrated primary care as well as behavioral health care. So we provide urgent care and same-day appointments, on-site laboratory services, state-of-the-art medical equipment and technology, and a patient online portal. In terms of behavioral health services, both children and adults can be evaluated and receive treatment at Shoreline Family Healthcare for a wide range of mental health and substance use issues, including short-term individual therapy with those receiving primary care, children's intensive outpatient program, which we're going to hear about today, medication-assisted treatment for folks with substance use disorders, medication management, and mental health and substance use assessment and treatment. I'm now going to turn the program over to our content experts to talk about the intensive outpatient program. Sarah Beard is the Director of Children's Services at BH Care, and Julie Falcone is the IOP Supervisor at Shoreline Family Healthcare. Between them, they have over 20 years of experience in children's mental health, and specifically with IOP programs. So Sarah, I believe you're next.
Thank you, Michael. We're so happy to be here and share about this program. I always like to start off talking a little bit about children's mental health, just to give us some perspective. 50% of all mental health conditions begin by age 14 and 75% by the age of 24. The average delay between the onset of symptoms and intervention is 8 to 10 years. 1 in 4 parents find it difficult to get their child mental health services. 70% of all the kids that we see usually have a history of trauma. 20% of kids ages 13 to 18 live with a mental health condition. I could go on all day, but I just think it lends us some perspective into what's going on with our kids in the community. The definition of mental health in childhood. It's the Center for Disease Control defines this as children being able to reach developmental and emotional milestones while learning healthy social skills and how to cope when there are problems. Mentally healthy children have positive quality of life and can function well at home, school, and in their communities. In our child work, we really focus on child development, which drives a lot of what we do. If kids aren't meeting their milestones, we're always looking at what is holding them back and what we can do to help with that.
So just a little overview about the intensive outpatient program. We serve teens who have severe emotional and behavioral issues at school, home, or in the community. Right now, we do have a group running for the adolescent group. They are ages 14 to 18, and coming soon, we are going to be adding a middle school group, which is ages 11 to 13. The objective of the program is to provide stabilization as a step down following a psychiatric hospitalization, or to prevent needing a higher level of care. So if you look at the level of treatment, you have a hospitalization, which is one of the highest levels of treatment. And then you have your standard outpatient treatment. We are the treatment right in between. And it's pretty much just saying that every child that comes into the IOP program needs to be seen more than just once a week. Clients that attend the intensive group therapy, they attend from 9 to 12 hours per week for the average length of stay for 8 to 12 weeks. Treatment is focused on emotional regulation, coping skills, and social skills through a trauma-informed curriculum. Cognitive behavioral therapy and motivational enhancement therapy for substance use is also incorporated into the program. And we also provide toxology screenings, and group runs from 3 to 6 p.m. Monday through Thursday.
I think the substance piece is something that makes our program unique. For so long, any type of substance treatment with adolescent teens was always something that was separate from the mental health piece. And now we're really trying to incorporate it together for there to be more prevention and just actually being able to treat those kids who have substance use disorders in the IOP. The IOP has psychiatric services, so that is a component of the program. Every child who comes in to the IOP receives a psychiatric evaluation and a medication management evaluation. A lot of the kids we do see come to us with medication already on it, but we're also able to assess and see if they need it. During the program, everyone gets a monthly med check. That's the minimum, but a lot of our kids see the doctor more than once a month. This is actually our Dr. Brian Keys. He is a board certified child, adolescent, and adult psychiatrist. He comes to us with a wide array of experience working in IOP, outpatient, and substance use. So we're just happy that he's part of our team.
So just some warning signs for the kids who come into the IOP: decline in school performance, the inability to cope with problems and daily activities, frequent physical complaints, sexual acting out, depression, which includes prolonged negative mood and attitude, difficulty sleeping or thoughts of death, abuse of alcohol and/or drugs, the intense fear of becoming obese with no relationship to actual body weight, persistent nightmares, threats of self-harm or harm to others, self-injury or self-destructive behavior, frequent outbursts of anger or aggression, frequent threats to run away, aggressive or non-aggressive violation of rights of others, which include opposition to authority, truancy, theft, or vandalism, and strange thoughts, beliefs, feelings, or unusual behaviors. Now, some of these kids may only present with a few of these symptoms or maybe even one, but it really just depends on the severity of the overall symptoms and how they affect the child's life and their functioning.
And we also do, an extensive screening process. So if you may think you have someone that would benefit from IOP, we would do the screening and see if, they are someone that meets the criteria, having issues at school, home, in the community, or having just maybe one significant issue in one area that, as Julie said, is really impacting their ability to function. Just reiterating what the treatment focus is, emotional regulation, social skills, coping skills, and improving family functioning. We just want to focus on the fact that it is short-term stabilization. So we're really trying to build on these skills during their time with us.
Just an oversight of what a typical day in the IOP looks like. We always start group with check-in. This allows members to check in and report their current mood, emotions, or any issues that may have come up. This also allows the clinician to assess for their mood, their high-risk behaviors that they may be displaying. And this also allows peers the opportunity to provide feedback to one another in order to build connections and provide support to others. It also gives the clinician an opportunity to see if the clients are actually utilizing the skills that are being taught to them while in group. Following check-in, we typically do a movement activity or a therapeutic game. These are activities designed to encourage group cohesiveness and connection with peers in the group, as well as using physical movement to connect the mind and body. Following that, we go into the curriculum, which is attachment, regulation, and competency. So it's ARC for short. They're activities that are geared towards self, identity, emotional regulation, social skills, and building healthy peer relationships. And then following all of that, the last 30 minutes, we typically do a wrap up and reflection. So this is where we reflect on the day in group. We continue to assess for any risk factors with clients before leaving, and as well as incorporating some group social activity, again, to increase positive social skills and interactions.
This is one of our actual group rooms at Shoreline Family Healthcare. As you can see, it's newly renovated. I think, when you're thinking about a kid going to the intensive outpatient program, it really is important to look at, all of the factors that are going on in that child's life and why, once a week therapy isn't sufficient. I think, Julie and I so long have, spoken to parents whose children are decompensating. And so, once a week isn't doing what it's needed. So we really look to the intensive outpatient to give that infusion of coping skills, social skills, to then help them to be able to, deal with the issues of everyday life. And so I think when you're thinking of, clients or students who you might want to be referring, that's who it really is targeting. Sure, there's always the kids that we see that are in the hospital, and this is a step down from the hospital, because when you think about it, they're inpatient, and now they're going to be coming to us 3 to 4 times a week after school, for those 3 hours, but also for the kids that we're really trying to divert a hospitalization and try to catch things before they decompensate. So those are the kids I really, want people to think about, do they need, the group setting? A lot of parents have, spoken to Julie and I over the years about, I don't know if my child will talk in the group, but I think, Julie can kind of, reiterate that being in that setting and hearing from peers that they aren't alone, that they're not the only one having this type of an issue, or hearing feedback from peers about certain situations, it can become a very powerful experience for these kids to hear it from not just another adult telling them like this or that, but hearing it from a peer, the good and the bad, for some of our kids that, struggle with being socially awkward, hearing from a peer, maybe I would have taken this approach or done it this way. It's just very powerful to watch that happen in the room and to then see those aha moments with the kids.
So who we typically get referrals from, we get them from schools, hospitals, physicians, community providers, and often we do have families calling in themselves to refer their child. So as you can see, my name and contact number is on there with my telephone and email.
Okay, thank you both very, very much. This would be the time to put some questions into the question and answer section. I have a few, but please feel free to do that while we continue. Sarah, Julia, you can field these however you want, but I'll read some of them. If someone is in individual treatment with another provider, would they continue with that provider while they're attending IOP?
So typically, no. If it's an outside provider, again, it's case by case. If it's a specialized treatment where we feel as though the client would benefit from having that intensive level of care with the outside provider, like if it's trauma focused work, we would keep the outside provider involved. But because this is such an intensive level of care, if it's just your standard individual therapy, we would ask that it get put on pause for the time being.
Thank you. Here is a couple more. What are the hours and does it require that children miss school?
So our program runs from 3 to 6 p.m. So for the majority, it would not require them to miss school, especially for high school and middle school. The only time there could be some missing of school is if it's around the psychiatric evaluation or a med check. And then, you know, we provide notes or whatever would be need, but the bulk of the program is done after school with just, you know, that thought in mind that a lot of kids get stressed, you know, with the idea of having to come to the program, missing school or missing work.
Okay, another question. What did you say the age range is for the program?
So right now we have the adolescent group, which is ages 14 to 18. And pretty soon we are going to be starting the middle group, which is 11 to 13.
Okay, thank you. Are your meetings in person or are they virtual?
Right now we are doing telehealth. However, we are moving to actually begin in person, starting actually with the day that we do our family group. So we're kickstarting that. It's been interesting, you know, a lot of parents have liked I think the convenience of being on telehealth, but we really want to bring it back to in person and get the kids in the room because it's just, you know, much more of a good experience, I think, all around. So we're going to be starting with Monday nights in, you know, Monday afternoon, evening in person. I see one more. Do you provide transportation? So we do not provide transportation. However, if some kids do have Husky, then they're able to get transportation through VEO, which we will coordinate.
And what insurances do you accept? Go ahead, I'm sorry.
I'll let Julie, we're in the process of actually getting credentialed with a number of insurance panels. Right now, we take Medicaid, Husky, Aetna,
Cigna,
Anthem,
and Cigna as well.
And in terms of out-of-pocket expenses, with that, we work closely with the insurance that they find out, you know, have they hit their deductible? Have they met their deductible? Is there a copay? So we work along them for that. And if people need to be on a sliding fee scale in terms of paying that, they work alongside them with that as well.
Another question. Following a referral, how long does it take for a child to actually get started in the program?
It's typically a very quick process. So once the referral comes in, I then review it with the clinical team, and then I coordinate with the family a day and time for them to come in. It's typically, you know, I tell families it's a 2-hour block of an intake process just because I'm gathering all of that information in one sitting. And then they can start the group as soon as the next day, as long as they don't need the transportation through VEO, because that takes a little bit of time.
Okay, kids are hungry after school. Do they eat with you?
Yes, we provide snacks for them. We provide snacks and water.
Yeah, we usually do 2 snack breaks when we're back to in person because you're right, they are hungry. And I don't know if we're all familiar with HALT, hungry, angry, lonely, tired, right? So yeah, I'm all about feeding the hunger.
Could you say that again? Hungry,
HALT.
what is it?
It's just an acronym, HALT. Some of us who, you know, in the therapy world, Michael, and it stands for hungry, angry, lonely, tired. If you're feeling any of those things, you better stop and kind of identify what's happening within your body. So it's just kind of a joke among us, you know. And for that hungry one, that's an easy, you know, get a snack or get a drink just to rejuvenate.
Okay, thank you. That's helpful. How do we make referrals?
So I have my email up, j.falcone@fhchc.org. You can simply just email me or give me a call at my number as well. I can provide you with the referral form. You fill it out, send it back, and then I'm in touch with you along with the families.
And I see someone asked about elementary school age children. I think, you know, right now, in the area, we don't have the intensive outpatient. However, we're looking to add some outpatient services, and Julie is certainly around to do assessments and to see, you know, what we need to do. So I wouldn't, you know, deter anyone from an elementary school age, you know, given a referral in, because I know right now services and trying to find treatment has been really challenging for the community.
Are there any kids that you would not accept into the IOP program?
Well, I think it's all about safety when it comes to that. So I don't think we are ruling anyone out. However, you have to be able to be in a group setting. So, you know, anyone that we ever don't have in the IOP, it's because they needed a hospitalization or a subacute or something, a higher level of care.
Okay, are you available for med management services only? Do all your patients do the IOP?
No, we would not be able to do medication only. However, at Shoreline Family Healthcare, if they're receiving their primary care there and they do pediatrics as well, you could then get medication through there. So same facility, same building. Julie actually just did a referral with someone whose pediatrician would not prescribe, you know, an antidepressant. So she was able to do a referral over to Shoreline Family Healthcare, and they were able to get them in and take over that medication piece.
Let's see, I don't know, I missed some here. I seem to be going through these pretty quickly. That's really good. Oh, one new message.
I think the other piece would be if anyone has any other questions or wants more information, Julie and I are, you know, always free to come out to a school, do another Zoom meeting, you know, whatever it takes to kind of spread the word. And also, you know, get people connected to the right services. You know, I think for so long I was the intake coordinator at the Parent Child Resource Center, BH Care. And I can't tell you how many parents I would talk to all the time, just feeling like they hit a dead end. And that's not something that we ever want to do. You know, we want to be that hope to people and be able to connect them. Maybe it isn't with our services, but it's the right services that are going to, you know, get them to help their children achieve their developmental milestones. So we're always free to take any calls and to speak to any parents or other, you know, professionals about what we're trying to do over here.
Sounds good. I know we've gone through it quite quickly, but I think we've done a pretty thorough presentation on what the program is. Any final thoughts on what you think people ought to know?
No, just if they have any further questions, to give us a call.
Okay. Then I think we'll end it there. Hopefully, if you have the contact information, please feel free to get in touch with Julie. And I want to reiterate what Sarah said. You may not think that a child needs IOP services, but if you're concerned that they need some kind of services, you can always make that referral and get the evaluation, and then we can help determine what the appropriate level of care is. So thank you, Julie and Sarah, and thank you everyone for attending, and have a great day. Thank you.
Thank you.
Thank you.